In a healthcare setting, what is the primary purpose of obtaining informed consent from a patient? So, to break down what this is, consent means to agree to something, so you agree. So in order to have any sort of procedure done, operation, minimal or not, the provider needs to make sure that the patient agrees or consents to the procedure, and they also have the right to deny or refuse to have something done if they don't want to. However, the idea is that in order to have a proper agreeal, in order for it to make the most sense and be the most valid, we need to make sure that it comes with information and that it's an informed decision, meaning that you have all of the right steps and information in order to make the best decision for yourself as the patient, meaning that if a patient just says, oh yeah, I agree, but maybe they weren't properly given, oh, it could cause this sort of complication, or oh, this is maybe a risky procedure, and they agree, that then we can't go back and say, oh, well, the patient agreed to it because they didn't agree given proper information. As opposed to if they do have all of the information given, they know all the risks, all the benefits, then from there, if they say, oh, yeah, I agree, I think it's worthwhile, or no, I don't think I want this done, I don't agree, I don't consent, that it's a proper informed consent because they made the decision using all of the information that they could have been given to make the best choice. So now that we understand what informed consent is, let's look at the choices and see which one matches that idea. So option A says to protect the healthcare provider from legal action. And remember in these types of questions, primary purpose, meaning that when we have just purpose here, there may be other options that, yeah, that does relate, but we're looking for primary. What's the main number one reason why we're doing this? So although, yes, it does protect the healthcare provider from legal action because they could go back in their notes if a patient then retaliates, let's say, oh, I never agreed to have this done, then they could go back and say, oh, well, you were given informed consent. You were given all of the information. You knew no risks and benefits ahead of time. However, we're looking for the main reason. Why are we doing this? So there might be a better option here. So let's come back to option A. We'll eliminate it for now. Maybe we'll come back to it. Option B says to ensure that the patient understands the risks, the benefits, and the alternatives of a procedure or treatment. And that seems to summarize exactly why we do all of this informed consent. We want to make sure the patient agrees properly, given all of the information that they need to make the best decision. And that's the primary main idea of what informed consent is. So we will go with option B. Let's look at the other choices. Option C says to document the patient's insurance information, and that's just not related to this right now. And then option D says to provide a record of the patient's medical history, and that's not what informed consent is either. So that leaves us with option B, ensuring that the patient understands the risks, the benefits, and the alternative. That's our number one goal. And anytime that you have these choices, or maybe more than one seems like it could work, just think which one relates back to patient care, which is overall our goal of the health and the safety and the accuracy of what's being done for the patient. That's usually the choice that this exam is looking for. So option B really fits that here.